Hi guys, Dr. Teva here, and we have Dr. James coming from the Hunter Valley practice. Welcome to our Friday Live. Today we are talking about babies, sleep in babies. Okay, so actually, if you are struggling, if you have a baby recently, or if you know someone that have a baby, then the baby is not sleeping quite well, or if you have a bit of a hard time putting baby to settle them down and have a bit of sleep issue, that this is something that we're talking about today. So sleep actually cycle developed really rapidly during that first couple of years of life, and when babies are at birth, they usually sleep around 16 to 17 hours per day, and that is because their circadian rhythm have not developed yet. But then when it comes to about 10 to 12 weeks, they sleep. This time of sleep actually decreased to about 14 to 15 hours per day because their circadian rhythms start to develop. So what we find out is the reason why that baby is not sleeping is actually coming from many different factors, but one big one is birth trauma. So even if there is no trauma, infants can still receive some sort of musculoskeletal injuries. One case study actually indicates that they say 70 up to 73% of infants have one or more musculoskeletal asymmetry stemming. So some common signs to look out for is if your baby have sleeping issues, if they have difficulty in feeding, the time of prolonged crying time, okay, some sort of consistent head tilt towards one side, this light car, bathing, tummy time, and something like that. So Dr. James has some cool research to tell us about birth trauma and sleeping issues in babies.
Yeah, so a study out of England over the last few years looked at a cohort of about 220 patients. These, the average age was just shy of 3 years of age. So they were looking at a correlation between birth trauma and sleep, or sleep problems. So out of that 220, we saw 54 had an ongoing sleep issue, 90 had a pain issue, and 62 had issues with feeding. Mm. So of those, 25% improved with chiropractic care pretty quickly, and there was another 30% improvement with patients presenting with other issues as well. So these are things not related direct to birth trauma. So this might be feeding issues, this might be increased crying time, your head tilt, not liking the car, the tummy time, bathing time, or getting them changed is another really common one as well. So, like Dr. David said, if you do have a newborn or a younger child that is struggling with sleep, or if you know somebody who does, why not give us a call, come in, have a chat, see how we might be able to help manage what's going on for you. But otherwise, we wish you all a great weekend, and we'll see you all next time.